The Slocum Dickson Medical Moment, Slocum Dickson Medical Group. You can find them in New Hartford, sdmg.com, Facebook, and Twitter. Make sure you're giving them a like, giving them a follow. And on the phone lines right now, I have Dr. Kimbery Hurley. Good morning. How are you?
Good. How are you?
Doing so good. Happy to have you on the phone lines because you are new to Slocum Dickson, correct?
Yes. I just started 3 weeks ago.
Oh, my goodness. 3 weeks ago. Hopefully you're loving it so far. But tell a little people about who you are, what you do, and where you came from.
So I am a podiatrist, so I do foot and ankle surgery, and I also treat patients for conservative foot and ankle problems. I joined Slocum Dickson, like I said, 3 weeks ago, but prior to coming here, I practiced in the Philadelphia area for 11 years.
So I've got a big question for you. Why feet? Why did you become a foot doctor?
I think it was less about feet and more about the opportunity to treat a lot of different conditions. So I get to see people who are athletes, I get to see people who are 95 years old, and I get to see everyone in between. So I treat people with sports injuries, I treat people who have traumatic injuries, but I also treat people who just have pain from going on a walk over the weekend, or someone who has a spot on their skin that they think looks funny. So I kind of get to do a little bit of everything, and that's what drew me to the profession. And you keep people moving, that's for sure. Yes. And what is the most common thing that you see? I think probably heel pain, or people plantar fasciitis. So when people say that they have pain in the bottom of their heel, pain when they first get out of bed in the morning, that's probably the most common condition that I treat people for. So, if you're talking pain, when should people really call you? Is it not till it's severe, obviously, but those pains when you first wake up, not normal? It's not normal, and I think, it's really when it starts affecting your day-to-day routine. So everyone has aches and pains every once in a while in their feet, but if it starts to become a recurrent problem, you're noticing it happening every day, you're getting to the point where you're like, oh, I need to take ibuprofen every day, or I'm putting ice on my foot, then those are times when you want to come and get it checked out. For sure. And then what's something that people can do to give them make sure they are taking care of their foot and their pain and whatnot? I think the number one thing is just making sure that you're wearing the right shoes for the activity that you're doing. So, a lot of times I'll see people who say, well, I'm having a lot of pain in my foot. I went on a 5-mile walk wearing flip-flops. Well, You shouldn't do that. Yeah. Fair enough. It's just, making sure you are paying attention to them because, it is simple things like that, but I'm sure you have lots of tips and tricks for people, and especially if they're feeling that way, they can reach out and make an appointment with you. Definitely. So if you want to, more details, sdmg.com. You can make appointments online. You can call up and you can learn more there. But also just one thing about the athlete thing, because you said that was probably one of the coolest things. For athletes, is there something in particular that they should be doing to protect themselves? I think, not just conditioning for your sport, but overall body conditioning helps. So when people, it's definitely become a bigger part of even young athletes to do strength training. Yeah. And I think that's really the number one thing to help prevent sports injuries. 100%. If you are feeling maybe it's time to get checked out, Dr. Kimbery Hurley, located at Slocum Dickson Medical Group, taking new patients now. You can check out all those details and more details at sdmg.com. Thank you so much for talking with me today. Thanks for having me. Of course.